An unknown skin disease has severely impacted many residents in Busia district, leaving them in urgent need of the medical supplies. Abdul Rashid Wiri, one of the victims, expressed frustration over the lack of assistance, noting the disease has spread throughout the sub-county with no help in sight. Wiri was particularly disheartened to see the district focusing solely on the mass animal vaccinations against the rabies while neglecting the human suffering caused by the disease. He reported that his brother succumbed to the illness within just 4 days of being affected.
Nze kenyini ayogera nange nalwalako obulwadde oluvannyuma muganda wange okufa. Nange nalwala ne mu maaso mulaga nakola tinalwala. Naye ekituufu kiri nti gavumenti tetuyambye kikwatagana n'obulwadde buno. Ffe kenyini tweyiiya ng'abantu ne tubeerawo. Naye ekitwewuunyisa nnyo munakale mu kitundu gavumenti yakola pulogulaamu y'okujjanjaba ebisolo nga embwa ne pussy.
Susan Layanyo, a widow who lost her husband to the disease, shared her tragic experience. She recounted that their children was the first to be affected by the skin disease, prompting them to seek treatment at the private clinic. Unfortunately, the disease later spread to her husband, who developed the severe skin rashes and passed away within the 4 days.
Obulwadde bw'obuvuddeyo ku mubiri gwonna tewali yasigaddeyo paka ku mukono, naye nga akaaba ati kimuluma ekifuba, kimuluma omutwe n'empewo nga nyingi.
Bernard Maginyi, a resident of Bukobe, a village, reported that all 8 of his children have been affected by the disease. He initially sought treatment at the nearby clinic, but as the cost of the medicine became expensive, he turned to the local herbs in an attempt to manage their condition.
The life at home is difficult because I have a family of 3 children. My brother left there, my family, and to manage them because of my last job, it is very difficult. Some days people sleep without food.
Government should come in to help this area because they came and took samples of which they have not brought the results. We have not got even any clear information about the sample. So we just request the government to come in so that these people of this area, the sub-county and the parish at large, should not be restricted to other activities, economic and socially.
Kati nekuma tutya naye nga gavumenti tetuwa obuyambi abantu tulwadde semwenyini nakalwasa abaana 8 bona nga balwala ekirwadde kino.
Lam Mayende, a clinical officer on the Busia District Health Educator, disclosed several cases have been documented and massed for general hospitals. Samples from the 8 patients were sent to the viral laboratory in Entebbe for testing, but the results came back negative for the suspected monkeypox.
But despite the negativity of the sample, the beauty is that the treatment for monkeypox is supportive. The other beauty is that monkeypox is very, very preventable. What is very key is that true monkeypox is available and is with us. 2, monkeypox is very highly infectious, but the fatality rate of monkeypox is very low and it can be prevented.
He added that they are using monkeypox drugs prescriptions as a basis for diagnosing the disease. Additionally, they are conducting sensitization campaigns to educate the public on the preventive measures to help mitigate the spread of the illness.
From the time we got in the first 2 cases, the first thing was, 1, to report. We reported to the district, and the district also reported to Ministry of Health. Okay? 2, we went on ground to do mapping. So when we did mapping, we discovered that it was so far in one sub-county at that level. It was in one parish, okay, and several villages in that parish.